Hello again everyone, Dr. Dan Bockmann here, and today we're going to talk about the fact that no injury has just one cause. They all have multiple causes or multiple contributors to that injury. So even something like falling down the stairs, I fell down the stairs and my shoulder hurts now. You'd think, well, it's pretty clear why your shoulder hurts, you just fell down the stairs. But think about this, what if your joint mobility was really limited before you fell, and that by itself, like I could only raise my arm this far, or I've only got 20 degrees of hip flexion. Those mobility problems are going to make it much more likely for you to trip and start your fall process by themselves. Also, when you've started falling or stumbling, your body can't conform itself into the shape it needs to catch itself or prevent the fall either. So mobility problems can make an injury much more likely. Also, if you're just not strong enough to absorb the impact or catch yourself, that could lead to that fall also as well. Now, no one of these things is going to be the sole cause. They're all contributors, I like to call them. And so when we're evaluating as rehab professionals patients who have injuries, we have to look at all the possible causes and zoom in on the top contributors. Meaning, let's say you may have one contributor that's 50% of the reason they got hurt, and then you've got one that's 2%, and then you've got a 15%, and you've got a 30%. So that may add up to more than 100%. But my point is that you have multiple, you have varying degrees of contribution for all these things. So as an example, let's say you have a patient with back pain who is getting half the amount of water they need to get per day. So they're dehydrated, they're getting half the amount of protein they should get per day. They're diabetic, they have thyroid issues, they're only getting 3 hours of sleep a night. I think we can agree all these things are possible contributors to why their back might hurt. Not that they're the sole reason, but they're going to make that problem worse, make back pain more likely to happen. Not to mention all the onboard problems you can have, flexibility problems, strength deficits, balance issues, or technique and postural issues. There's a whole host of things. So the way I like to approach it is cover all the top ones first in my consult with a patient and during exam too. And of course, my top two things I'm looking for are mobility problems and stability problems. They are together 80 to 90% of the reason for all musculoskeletal pain I find in practice. So we'll look at those first, and if we find some big egregious deficits there, we're going to charge those first head on, because that just means if we address the worst things first, then we're going to get bigger results faster, and it'll also confirm our treatment path. As opposed to if they're 6 ounces low on water a day, and we address that real hard and heavy, and then we say, well, we'll see if that fixes it. If they're 6 ounces low on water, that's not going to make a big difference. That's going to be a small contributor. But if they should have 90 degrees of hip flexion and they've only got 20, that's a big deficit. Hey, we're going to aim at that thing with our big guns first. So hopefully that makes sense, and that's how I address all musculoskeletal complaints in rehab. Hope it makes sense. If it does, great. And stay tuned for more rehab nuggets like this in the future. And as always, until next time, I will see y'all.